guys, my name is Sim. Today I wanted to give you an update about what is going on right now in New Zealand in regards to COVID-19. I also wanted to talk a little bit about the PCR test and vaccines. Now, as per my last video on social distancing, I am not being paid to talk about this, and what I'm going to say is just my personal opinion. This is such a polarizing topic and can make a lot of people feel really angry or upset. So of course, do your own research so that you can reach your own decision. I will link any references that I've used in the description. In my home country, New Zealand, when the government sends an emergency alert to your mobile phone about a lockdown, this is what it sounds like. If that doesn't put the fear of God into you, I don't know what else will. In actual fact, in the beginning of the epidemic, we had one of the world's strictest lockdowns for 4 weeks because we needed to flatten the curve. New Zealand public health advisors admitted that we are all taking part in an experiment, and it's hard to know what might happen. Soon enough, the goal became to eliminate the virus entirely.
Did you know heart problems are the #1 cause of death for Americans? The #1 way to prevent heart
As if! Now, up until recently, lots of international media had been praising the New Zealand government on their success of 100 days with no community transmission. Of course, from the outside, people want to know, how did this happen? This is where it gets interesting. I wanted to go over the community testing procedure prior to August. Essentially, to get a COVID-19 PCR test done in the community, you had to have symptoms, plus be at risk of having caught the infection. So symptoms being defined as having a new respiratory infection, plus or minus a fever, plus another symptom like new or worsening cough, sore throat, shortness of breath, runny nose, or loss of smell. I won't bore you with the details of what it means to be at risk, but all the expected stuff like recent overseas travel in the last 2 weeks, etc., etc. The key point here is you had to have symptoms. Now, why is this important?
With fireproof paper, you'll always feel secure. Tune in next time and with this Muppet Lab's new answer to the energy crisis, flammable water. That's all for now from Muppet Labs.
There is a fundamental concept in medicine which is called pre-test probability, and this was tattooed into my brain at medical school. And in simple terms, pre-test probability is the chance of a patient having the target disease before the diagnostic test result is known. So for example, you don't test for pregnancy in men because the chance of a biological man being pregnant is 0. All tests have a possibility of reporting a false positive or a false negative, and if your pre-test probability is low, you are more likely to get high false positives and false negative results. So what does this mean for the COVID-19 PCR test? As many of you already know, there are major problems with this diagnostic test in that it doesn't test for the virus. It tests for a piece of genetic material that we don't know the significance of. The PCR test has never been compared to a gold standard because there is none for COVID-19, and that in itself makes interpreting the accuracy of positive and negative results very problematic. I'm not going to talk about this in detail as other YouTubers have already covered this topic much better than I can, but let me play devil's advocate and assume for argument's sake that this PCR test is scientifically sound. The PCR test is supposed to be used as a diagnostic test, not as a screening test. And the difference between a diagnostic test and a screening test is that patients that undergo screening do not have symptoms.
What did you say?
Now you might think, but lots of people have tested positive for COVID-19 who don't have symptoms. Exactly. How can one interpret this? It's because medical staff are testing people inappropriately. You can't use a diagnostic test as a screening test.
Right.
From May to the beginning of August in New Zealand, community testing stations started closing down and people went back to normal, with shops opening, people going back to work, fewer people social distancing, and even smaller numbers wearing masks. But then something changed in August. All of a sudden, COVID community testing stations were opening up again, with money available to start surveillance testing. This rolled out across the country with pop-up testing centres looking to test people without symptoms. Soon enough, there were 4 new cases in Auckland from an unknown source on the 11th of August, and then all hell broke loose and Auckland was put into level 3 lockdown while the rest of the country went up to level 2. Masks are now mandatory for passengers on public transport, and most importantly, there was a change from the ministry on how community testing is being done, which was that asymptomatic people are now being made to have COVID PCR tests.
Inconceivable.
Like I said before, the PCR test is not a screening test and should not be used as one. Right, on to vaccines. Again, I do not wish to tell you what to do or what not to do in regards to the question of getting a coronavirus vaccine. That should be entirely your own choice. Personally, I've had all my own childhood vaccinations and travel vaccines in the past, but I will not be getting the coronavirus vaccine in the future. And my reasoning for this is firstly that vaccines take a very long time to make, and it's likely this epidemic will have finished by the time one reaches the market. The shortest length of time to make a vaccine in history was 4 years for mumps, and that was pushed out in record time. Secondly, seasonal vaccines do not reduce deaths in winter in the elderly. Obviously, I'm not elderly, but there was a very good large study done back in 2005 that concluded that giving flu vaccinations to people aged 45 to 74 years does not prevent them dying from the flu. Overall, my main issue against vaccinations is that I do not believe they should ever be compulsory or required in order for someone to seek employment, gain an education, or to travel. Coronaviruses and influenza viruses are similar in that they are both seasonal, but I'm far more likely to die from poisoning or a car accident at my age than from COVID-19. Can you believe that after 9 months of the pandemic, something like 0.01% of the world's population has died from COVID-19? And these numbers include cases where people died with COVID rather than causally because of COVID. When you compare this to the Spanish flu, which killed 2 to 2.5% of the world's population, the fatality rate is far smaller. As always, please give this video a like if you found it helpful, hit the subscribe button for new videos every single week, and hit the bell to get notified when I post new videos on Tuesdays. Please let me know in the comments what you'd like to learn more about, and feel free to check out some of my other videos on infections. Thanks so much for watching, and I really hope to see you again soon.